Great. All right. Good afternoon, Commission. Thank you so much for joining today. This is the second part, or third part rather, to voting on the community equity priorities. We did our first vote for the first set of community equity priorities under the fundamental value, our government justly values all talents and contributions at the end of our third workshop session on Friday. On Friday, November 15th, we did our second voting session where we were able to get through some of our second and third community equity priorities under the second and third value set. So that's our second is our government ensures the conditions of every person. And then our third is that our government embraces vigilance, remedy, and reconstruction. We've gathered here online today to finalize 3 remaining community equity priorities. I am going to share the screen so that everyone can see what we're working on. And if folks can just share, like give me a thumbs up so I know that you can see it. Okay, great. Okay, so the last time we met, I just want to flag, like, we really spent a lot of time talking through what the strategies and indicators could be as we were moving through potential language. I want to uplift that today our focus is to finalize the language and approve of the community equity priority, and then we will come back as a commission and propose strategies and outcome indicators. I've highlighted the 3 that we need to work on, and that's up on our screen right now. Before we get started, does anyone have any questions?
No questions.
Okay, great. Thank you so much. So for the purposes of the recording and all of our core viewers that will watch this once it goes up on our YouTube, I do want to just note for the record, we do have quorum with over 8 commissioners present at today's session. So we had 3 community equity priorities that we struggled the most with. One under the charter value, our government ensures a condition of thriving for every person. And then there were 2 community equity priorities that we did not get a chance to discuss. And that is under the fundamental value, our government embraces vigilance, remedy, and reconstruction. We have approximately 40 minutes scheduled for this call. So I'm proposing that we move backwards and give ourselves the most time with the community equity priority that we spent a lot of time on in our last session, and focus on getting at least 2 completed in the next 30 minutes. So if there's no one opposing, we can get started. So community equity priority number 18, which is under the fundamental value, our government embraces vigilance, remedy, and reconstruction. Our draft priority language was to reduce the number of people of all ages in jail, prison, or court monitoring for criminal offenses and transform jails into rehabilitation centers. This is one of the community equity priorities that had the greatest level of disagreement. And that was for a variety of reasons. And just want to note, this is an open conversation. And so core staff that's on the line, please feel free to jump in, as you also were both engaged deep with community, but also in the analysis. So community members shared with us, for some people, if we had put rehabilitation at the top and reduce people secondly, they would have been more inclined to say that they agree or strongly agree. Many people raised that what they wanted to see the city do was increase prevention and intervention supports. We want to make sure that people are not committing mistakes or allegedly committing mistakes. but we also wanted to make sure that people who were incarcerated of all ages were getting the support that they needed to make sure that they did not make a mistake again and that they were set up for success when they were released. So we landed on, and I apologize, the percentages are noted here on screen. So 68.5% agreed, 13% disagreed, 14.3% neither agreed nor disagreed, and 4.2% did not respond to this particular question. We landed on expand services to prevent, intervene, and provide care for people and families harmed by policing, jails, and court supervision. This will increase safety and reduce reliance on jails. And should note here that people raised that policing and incarceration not only impacts the person who allegedly committed the crime, but it also impacts their families, their friends, the communities they come from, the communities that they return to. And so people did want a more of a comprehensive, holistic approach to addressing the impacts of policing and incarceration systems. Just going to turn to Maya Lorenzo if there's anything else that we should add as context for this. Okay. So open up for discussions, questions, reflections, comments. How do we feel about where we've landed from draft to final?
When we think, say, provide care, just going back to, I know you don't want to focus on what those indicators may be in the future, but what do we mean by provide care? Like what is the expectation there for agencies?
Yeah, I think that that's one that's open. And so it could be everything from ensuring that people who are incarcerated receive the proper mental health supports, like on-time mental health supports, that their loved ones are notified of any harmful experience they may have while incarcerated. I know both of those are right now current policy conversations. There was a recent hearing on this. It could also be making sure that people have their education supports, they're getting job training, they're getting access to supportive housing. So provide care is everything from physical to mental health supports and care, as well as like tangible what people need when they're released from, whether it be a precinct or Rikers or any incarceration center or detention center, to ensure that they will not make the same mistake again. This could also be connection to care, like to families, and help to rebuild bonds with their community.
Okay, so it's like a holistic kind of application that all agencies could be involved in. Okay. And then my second question was, and I apologize because I wasn't here in the last meeting, so if this was already discussed, I apologize in advance. But the word harm by policing, jails, and court supervision. So my only thing with that is that we're not saying like all policing, all jails, and all court supervision are, these terrible entities, right? Like, we, to a certain extent, we do need, public safety measures in society, right? So it just sounds that by saying harm by policing, jails, and court supervision just kind of sort of implies that all sorts of policing, jails, and court supervision are harmful. Is that the position we're taking, or is it, still the lens of, the policing methods and incarceration methods that are inequitable? Do you know what I mean at the question?
Yeah, I'm happy to jump
clarify.
in.
Yeah.
Right, I'm happy to jump in. I also just want to, I've been talking a lot, so I just want to make sure to make some room for other folks as well.
What if Sorry. Hi, it's Wendy. What if you wrote, I know this sounds slight, but might change the perception. What if it said provide care for people and families who have been harmed by? So instead of making it seem as if everyone's harmed by that, we're specifically talking about the people who have been harmed. Would that read in your mind if potentially more specific?
Yeah, I mean, I guess my not issue, but just one point of clarification is that, are we saying like that, all police or all law enforcement agencies are just, harmful? Like, is that are they harmful, or is it, these certain, practices and policies within these departments that are harming people? So are we targeting not the agency itself, but the practices and policies of the current law enforcement authorities? That's just what I want to clarify. Like, are we saying defund the police, or are we saying, defund, harmful practices and that police unfairly? That's just what I want to clarify from this portion.
I read it as expanding the services to the folks themselves
Mhm.
been harmed by those things that you indicate, not necessarily changing the things you're indicating concerning the policy. I mean, maybe that would be maybe that would be a strategy under the goal, that it would go to the how they're being harmed and why, but that the priority appears to be focusing attention on helping those who have been harmed because of those issues that you raised. I was going to say something stronger, but we're being recorded.
You're welcome to,
No, I think
you're absolutely welcome to be in full conversation, because we need to work through this language
Yeah.
so that we get it right.
Yeah. I hear you, Grace. I hear you on this.
Yeah. Yeah, no, Wendy, I find that incredibly helpful. Actually, actually rereading it again, you're right. I see it from that lens. I guess I just, I read the same thing and I interpreted maybe that phrase could be interpreted otherwise, but the way you're reading it, I totally get that. And that I don't have any questions about that interpretation.
I also think that if we're seeing this somewhat as a rubric, that city agencies will read this and be then maybe grounded, recentered, and or anchored by the term harmed by in the spirit of racial equity. I think we're trying to center them in those populations. So I just wanted to affirm what Wendy said, and also affirm you, Grace, in your thoughtfulness, because we spent quite a bit of time on this one as well. So we're right there with you in making sure we're accurate and kind of capturing what we're trying to say.
Yesenia, you had come off of mute for a second, and then I see Imam Ahmed.
Yes.
Um,
So I
and
also
Commissioner-
agree with Grace, harmed by policing, because technically police is here to protect us. And if they're not doing something right, that's not policing. That's against their patrol guide, because once they follow their patrol guide, everything is by the law. So this word needs more explanation or details, like what does harmed by policing means. It's not just a word. It's, technically we can see it that maybe anyone who is arrested by police is police fault. So it sounds like this, but sometimes, we all call 911 whenever we need, and they come to help us. So
Thank you, Commissioner Joseph, and then Commissioner Easterling, and then I'm going to offer a summary and ask if we could go to a vote.
No, I was just gonna ask if this language, sorry, I'm in an elevator. If this language includes that the box right next to it where it talks about need for programs to prevent
Mhm.
first-time crime. And I'm wondering if it doesn't include that group as well. Oh, thanks for scrolling.
Yeah, okay, so this language does reflect a change in reference to community members asking for additional programming. That's what we were trying to get at. So it does, to the degree that we certainly create we thought of this when we drafted the new language, that it should reflect what community was asking and community conversations as well as respondents to our online survey. Commissioner Easterling?
Yeah, as I'm thinking about this priority, I mean, I like the language. I'm still a little stuck on provide care, because that, that sort of, like, I sort of think about that as like, are we talking about healthcare, social care? And so I would think that prevent and intervene is enough for us to sort of think about the things that have been elevated by community, right? The need for programming to prevent first-time crime is already included in prevention and intervention, right? We may not need that for provide care. I certainly think it is important for us to sort of name who we're centering and sort of like who has been harmed by policing, jails, and court supervision. I think it also helps to sort of make concrete that these are structural issues, so that we are really trying to aim at addressing these structural issues. Then the third piece is, I'm not sure that the last sentence is absolutely necessary. This will increase safety and reduce reliance on jails. We certainly want that. That is the vision, that is the priority, but I would propose that we recommend that we delete the last sentence.
Okay, thank you, everyone. So just to make sure that
Can I
I'm
say one
following.
thing, Linda?
Yeah, absolutely. Go
So
for it.
just some context, I think that would be helpful, is a lot of the community feedback spoke to, like in particular in the draft language that we name like just criminal offenses. There are a lot of folks who were saying like there's a lot of people in jails right now for nonviolent felonies. The exhausting population of people that are in jails really bring up the providing care part to this finalized language, because there are many people who are in New York City jails right now who are dying aimlessly. They're not being like scheduled or even seeing like medical care, medical appointments that they're missing. So just to give folks like a context of why we try to like center all of that, because yes, it is prevention and intervention, but there are like things that are happening inside the jails that cause harm to people inside, but then bring them back into the jails once they're released, because of the lack of prevention, intervention, and just the detrimental like experiences that are inside of there. We've like shared data about like the health of New York City jail population. So this one was difficult, like trying to blend everything in. And I'm afraid if we remove language like providing care, we missed that piece that a lot of communities brought up, as well as really looking to see like what are other options that people suggest when we talk about harmed by, because there is a particular population that is being harmed by policing, by jails, and court supervision. So we can think on like optional language for the harmed by, or maybe even the providing care would be helpful.
Thank you. So, so also just want to add that provide care was also intended for families who lose their loved ones to the incarceration system, children who lose a parent, and that they need additional supports in their community and their family to be able to move forward, not only to keep or create bonds with those who are moving through the legal system, but also that there is now a huge missing in their life, some of which is likened to the death of a family member sometimes for people who get long bids, right? So just with respect to time, because I want us to get through this today, it sounds like, Grace, your original concern was addressed in the exchange with Wendy. I also heard a request to remove this last sentence. This will increase safety and reduce reliance on jails. Does anyone disagree with removing this last sentence? Okay, does anyone else agree, aside from Torian, to remove this last sentence?
Do we agree?
Do
Is
we
that-
agree to remove this last sentence? This will increase. Can I remove it?
I would, yeah, I would support that.
Me too.
Okay,
Yes, same as well.
great. Okay, I'm seeing a combination of
Me too.
yeses in the chat. Perfect. Okay. Let's circling back to harmed by. I heard a request to define, and I appreciate, Wendy, you had noted this other document that we will create to just further flesh out the CEPs. It sounds like this has been resolved and that we can keep harmed by in the CEP, but we'll do some work in follow-up communication to make sure that people understand. Does that sound good for folks? And I need some like thumbs up, yes, no.
Yes.
Okay,
Yes.
great. Kirsten,
Yes.
Joseph, great. Okay, so I'm gonna move us to a vote.
Are we saying yes because we want to keep harmed by? I'm sorry, I missed
Yes,
the question.
we
Okay,
wanna
great.
keep
I
harmed.
would like to keep harmed by.
Okay, perfect. So let's vote. And
So I had like harmed by abuse of authority by police or something similar.
so that I think would go in the definition of what we mean harmed by, but yes. And that would go in the follow-up.
Sure.
But you're 100% right on that. So let's do a quick vote. I'm going to go down, say your name, and then I just need you to vote. Well, Torian, let's start with you.
Well, no, did we get resolution on provide care? I guess, am I the
We're,
outlier?
oh, my apologies. The proposal is to retain provide care because that is in reference to not only ensuring that people get all the different types of services they're supposed to get in jail, but also that their families and communities that experience their loss also get care.
Okay. I don't agree, but for the purpose of this, I'll move forward. You know. Okay.
So you approve?
Yes.
Okay. Wendy,
Yes.
Amilcar,
Yeah.
Francesca,
Yes.
Yesenia,
Yes.
Imam Ahmed.
Yes, we need to discuss this more, but for now, I guess everyone is yes, then yeah, yes.
Adama,
Yes.
Sadie,
Approved.
Grace,
Yes.
Commissioner Joseph,
Yes.
Paysock, Paysock,
Yes.
Kirsten.
Yes.
Great, and I approve. And I just want to confirm what we're hearing is both, let's make sure to be clear about what we mean by provide care. Let's make sure to be clear about what we mean by harmed by. And so we will do that in follow up. The next one is also within the same fundamental value, close the racial, gender identity, age, and disability gaps in access and opportunity to employment and appropriately fund programs distributing money to start a business. That was the draft. 81.5% agreed, 5.8% disagreed, 9% neither agreed nor disagreed, and 3.7% were missing. So they didn't respond to this particular one. There was, again, from community, a sense of urgency around well-paying jobs to help their families thrive. There was a focus on jobs for young people as well as jobs for seniors that didn't kick seniors off of their benefits. And a general discussion around the ability to start one's own business. So to remain consistent with other language within our CEPs where we specifically name the gaps, we know we created final language that says to remove the gaps in racial, gender identity, sexual orientation, age, and disability access to job training and funds to start a business. And as a reminder, for those of you who may not have been here for our first workshop, we had a specific request from community to name sexual orientation. And so we moved from gender and gender identity to gender identity and sexual orientation. Any questions, comments, or feedback on this priority? Are we all okay with the language?
No concerns on my end.
Thank you.
I'm good.
Okay, well, let's move to a vote. Yesenia, did you vote in the last one? I apologize. Okay.
I feel
So-
like, I'm sorry, hang on. Weren't we saying like remove the gaps felt a little passive? And that we were like, I don't know, or maybe that was another one. It was a long meeting, so I can't remember, but remove the gaps, just like, it feels like I'm an agency, I'm reading like remove the gaps, like, oh yeah, I did it. I don't know. So
just, I'm scrolling up to see where we have similar language. Because we noted above too.
Yeah. We also say remove barriers.
Yep, so we have
Right.
both remove gaps, and in other places we say remove barriers and increase access.
okay, all right, cool. As long as it's aligned. Thank you for checking that's thank you.
We have both. Would you like to say remove barriers and increase access for this one?
I think it needs,
No, I think the gaps is what we wanted to do. I think so, right? Like we wanted agencies to draw their attention to the disparities.
Thank you. Amilcar?
I was gonna say, I think that increased access is exactly what we're looking for because that is what's gonna help remove the gaps. So maybe saying just remove the gaps, it's like it'll draw attention to it, but then
So okay, and Sadie put her thumb up. Kirsten, was that you?
Yes, I'm sorry, that was me, but it wasn't for you guys.
Okay. Okay. So if we use the same language to remain consistent, just pulling it up. Okay, so we have said from the top, remove gaps. Where do we have increase access? Lower the cost. Here we go. So we say remove barriers and increase access with respect to land ownership, being able to buy and retain land ownership. So if we say it here, we would be saying remove barriers and increase access in racial, gender identity, sexual orientation, age. And this doesn't fall in alignment with the way that we've used remove gaps in previous versions.
Alternately, also, you can do remove barriers and increase access to job training and funds to start businesses.
Okay.
Are we solving to add increase access? or are we solving to be consistent with other language?
Well, the primary solve is to close the racial disparities in job training and capital for businesses. That's
Just
the first
racial,
solve.
not gender.
Well, racial, what the intersectional approach that we've taken here so far has been racial, gender identity, sexual orientation, age, and disability, that all of that is embedded in racial equity and racial justice, right? So with respect to Torian's question, the original solve was there are racial disparities and disparities across all of these identities with respect to job training and funds to start a business, which is why we kept the language at remove gaps. It also aligns with when we talk about gaps in racial, gender identity, sexual orientation, age, and disability. When we do that in our CEPs, we use this language. Remove the gaps. When we talk about land ownership or sort of like increasing material goods that we understand are necessary for people to thrive, right? When we increase the ability to purchase and keep land, we have said remove barriers and increase access. So I want to acknowledge the two different things. So option, just for our site, this is option 1, right? Remove gaps. And then option 2 is to remove barriers. I'll also note that when we did the workshopping with all of you and community folks in the room, the focus then was also on the disparities with respect to race, gender identity, sexual orientation.
And just to
Mhm.
just to confirm the readability for both options.
It's a great question.
Get on that.
I think whichever option we choose, it does have to specify in racial, gender identity, sexual orientation, age, and disability access.
Agree.
Okay, so it sounds like we do want option number 1.
Yeah, I think option number 1, really, because you really want to bring out, as mentioned, the racial, gender identity, and sexual orientation.
Okay. Are there any disagreements here? Or any people voting for any people really interested in option number 2?
I think my hesitation is the readability for option 1. Weren't we aiming for grade 11?
We were aiming for a lower reading grade level, that's true. But we weren't able to get there here, but I think Lorenzo is working on the reading level.
Oh, I already updated it. It is
You
grade
did.
14.
It is grade 14. Okay. Would we be able, do we feel comfortable approving even at grade 14?
Yes.
I do, because I think our audience are still, this is, even though it's public facing, this is a document really for agencies to sit with.
Okay, so we're going to go back to this language and do a formal vote. Let's start with Wendy.
I approve, I agree.
Torian,
Approve.
Amilcar,
Approve.
Yesenia,
Approve.
Francesca,
Approve.
Imam Ahmed,
Yeah, I feel we need more time, but while everybody is yes, so yes, I agree.
thank you. Adama,
I approve.
Sadie,
I approve.
Grace,
Yes, approve.
Kalia,
Approve.
Pesach,
Yes.
Kirsten,
Yes.
and I approve. All right. So we have one more, and this is the one that we really spent a lot of time on last time around. And so this is under the fundamental value, our government ensures the condition of thriving for every person. We started, the draft that was shared with the public was institute and appropriately fund trauma-informed community safety practices and responses to mental health calls that lessens reliance on law enforcement. 82.8% agree with the priority, 5.7 disagree, 7.7 neither agreed nor disagreed, and 3.8 did not respond. When we spoke last time, where we got to was a recognition that community members by and large absolutely agree that the city needs to increase responses that are not punitive to mental health calls. And then we also had community members say not only mental health calls, but that we actually want non-punitive responses to other types of calls. One concrete example that came up in our workshop sessions was non-punitive responses to child welfare calls. In our last conversation, we really struggled with how to clarify that we want to lessen reliance on police. We want to focus on non-punitive. We want to be as expansive as we could for all calls. So we included mental health in all crises. And that we wanted to lastly uplift that the work that the city should be doing in order to ensure the condition of thriving for every person recognizes and respects an individual's decision to make decisions about their own care. And that in moments when a person may not be able to, they may be able to inform decisions about their care. They may be able to be partners with the responders when deciding on next steps. And we are balancing both respecting and acknowledging the human right to self-determination while also ensuring that the community equity priority that we share uplifts the safety for the person experiencing the crisis and everyone around them. That includes their community or their family. Lorenzo, Maya, did I miss anything in that summary? And also from community that you want to raise?
I want to say no, but I will also admit that I was slightly distracted because I was using the Hemingway editor.
It's all good. I appreciate you're on Hemingway duty and I greatly appreciate that. Maya?
No, I think you hit everything. I would just expand on the fact that a lot of community members really honed in on the lessons reliance and just feeling like they should be able to make decisions on that. And I guess if people have pushback, maybe things will like come up, but right now I don't think so.
So let's do a check. How do we feel with this current language on screen? Use and expand non-punitive responses to mental health in all crises. Wherever possible, these responses should lessen reliance on police and allow people to make decisions about their own care.
No, I don't think it says does it say crises? 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 Checking that word.
Please do, because
I don't know how to
I'm on
say
autopilot
crises.
with that word.
Crisis.
Yeah, that is how you spell crises. It's just a straight. They didn't want three S's in the word.
You learn something new every day. Okay, that's good to know.
Should be a word we're familiar with, sadly, right?
Right.
Multiple crises. Yeah, I think that's correct.
Yes, multiple crises.
That is correct. I think that this really took our feedback because we really stayed on this one for a while last time. So looking very good for me. But also noting that it's also grade 12, not against it. Just
Can I make a slight suggestion that would bring it down to grade 10?
Yes.
Instead of should lessen reliance on police, if you write should rely less on police, that brings it down to 10. And I think it's the same thing, although it sounds slightly different.
Imam, before you leave, can you tell us if you're okay with this language?
Well, where is the screen? Yes. Okay.
And if it's easier, you're welcome to put it in the chat. But I don't want to lose you when we're just at quorum and would need your vote.
So, well, again, like we discussed last time, that this matter is little bit like questionable, and we need to understand before we vote and move forward, because people, they are looking at us, and maybe you guys move on and let me see what you guys decide, and then we take it from there. Because my experience about policing is good, that I feel that they are here, they are our brothers and sisters, and whenever we need, we call them. So, like, I think we need more time to decide these things. Maybe on later sometime, but you guys go ahead and let me follow what you guys decide.
Okay, thank you, Mom, and thank you for your service.
Thank
I know
you.
you're going off to your duty today, so I appreciate you coming online. I know Francesca and Pesach, you also noted having to log off soon. So maybe let's do, if we can do a vote check before we finalize, and see if we do in fact need some more time. With the language as is, use and expand non-punitive responses to mental health in all crises. Wherever possible, these responses should rely less on police and allow people to make decisions about their own care. I'm going to ask that we vote. And if you would like to have more discussion, you can vote approve, discuss, or abstain, or no. Who would like to start us off?
I approve it. I like the language. Wendy.
Thank you.
Corain, approve.
Thank you.
Yeah, and I approve the way it is as well.
Thank you. Kalia, since you said you need to leave, would you mind letting us know where you stand?
I would like a little more time, but yes, I approve.
Yeah, I'm sorry, I don't want to interrupt, but so are we voting now, or like if we want to discuss more, like we can, what's the plan on that? Like if people want to discuss the language more, we still have to vote?
So I would like for people to vote now, and if you would prefer to abstain in service of discussion, just say discussion, and we'll see where we land.
Okay.
But I do want to emphasize that we will continue to discuss the CEPs so that we're clear on the strategies and the indicators. We're not doing that today. What we're doing today is the language, the actual language itself. So not what strategies we're going to share with the city on how to get this done or how we're going to measure change, but does this language reflect to you what you saw in the profiles, what you heard community say, the virtual presentation, the conversations that communities have been having with the city? Do you feel comfortable with this community equity priority? So you can vote approve, you can vote abstain for discussion, or just say discussion, or you can vote no. And we've got Wendy and
Linda, I'm gonna say discussion.
Okay, great discussion.
Discussion.
Okay. Grace?
Yeah, and again, I apologize because I missed the last meeting, but I'd like discussion on this one.
Okay.
It's Francesca. I have to log off, but I would like to discuss it more as well.
Okay. Okay. Yesenia?
Yes, discussion as well.
Okay. I think at this point, actually, we have a majority of people saying discuss. We do have folks signing off. We want to, our goal was to get this out this week. Can people do a meeting tomorrow?
What time tomorrow?
Can we do 10 a.m. tomorrow? It's a Tuesday. And the goal would be just to discuss this one.
I have something 10 to 11.
Right.
Okay.
11, I could do it. I'm sorry.
Okay, so I will send out some scheduling messages and try and get us together. Again, the goal is to finalize this week. Ideally to finalize tomorrow at the very latest. We will only focus on this one. And I'll be reaching out to folks to get a better understanding of where we land. Thank you so much. We're so much closer to having a full set. But I do not want to release the priorities until we have this conversation. This came up repeatedly in every single conversation, in every single community. So we really can't move forward without having an answer on this. It would not be right for community.
Can I just propose also for folks who want to discuss, if you can bring back any kind of proposed language? That way that'll help us with the discussion and shorten everything. Thanks.
Okay. Well, thank you, everyone. Have a great night. Stay safe, and we will see and talk to you all tomorrow.
Night, everyone.
Bye.
Have a good
Thank you,
night.
Linda.
Thank you.
Thank you.
Thank you.
Linda.
Thank you,
Take care,
guys.
everyone. Have a
Thank
good evening.
you.
Thank
Bye.
you.